Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For a paid online consultation, you can definitely WhatsApp on 922-6810-630. The number is always there in the description. My dear friends, this is the very interesting series that I have made since last 1 month. I am taking the efforts to make this serial. And in this series, in the each and every episode, you are understanding the different patients with the different complaints. They are coming to the general practitioner and how your family physician, general practitioner, think about this particular differential diagnosis, causes of the complaint, and how the examination should be done, investigations, and also the management. Very rarely, I have also discussed some cases which cannot be treated many times in the general practice, but he has to refer the patient into the hospital. Today's case is in between. That means if the doctor is confident, he can treat. If he is not confident, he can refer the patient to the nearby hospital. So the 40 or 50-year-old male patient, the visit is there. The doctor is asked to come for the visit, and the patient was there on the bed, and around all there are 2 or 3 relatives were there, especially the wife was there. The 50-year-old male was on the bed, and the lady is anxiously telling to the doctor, "See, doctor, my husband is a diabetic and he has suddenly become unconscious for last few minutes. We are very afraid, but we actually wanted to shift him in the hospital, but we said better you first, we should call you as a family physician, our family doctor, and then as per your recommendation, we will shift him if you want to shift him." Okay, relax. Just give me some minutes to check him up. So the doctor has immediately in his mind, the patient is 48-year-old male. He is a diabetic. He is unconscious. So there are 2 important causes for diabetic unconsciousness. Unconscious diabetic patient, 2 important causes. One is hypoglycemic coma, or second is hyperglycemic coma. So very simple for the doctor to decide in between 2 diagnoses, differential diagnosis, 2 different important causes. One is hypo, less blood sugar, and second is hyperglycemic coma, that is above the normal, the blood sugar level, and coma is unconsciousness. So either it is because of the less or it is more of the blood sugar level. As you know very well, actually I request each and every diabetic patient, the family member should, what you can say, make savings and purchase glucometer at their home, and regularly, at least once in a week, once in a fortnight, once in a month, blood sugar should be checked for the fasting blood sugar and postprandial blood sugar, that is after lunch. My dear friends, for example, if the patient has finished lunch at 1 p.m., then what time the blood sugar should be checked? Around after 1.45 minutes. That means 1 o'clock, the lunch is finished. So 1, then 2, and 2:30, 2:45. At 2:45 exactly, in between 2:45 to 3 p.m., the blood sugar should be checked. If the lunch is finished at 1 p.m. and if you are checking the blood sugar at 4 p.m., 5 p.m., no use. That is called as a random blood sugar. That is not postprandial blood sugar. Of course, everybody knows now, as each pathology lab has a different criteria for the normal values, but in general, 80 to 120 or 7 to 110 milligram percent is a fasting blood sugar, and 70 to 140 milligram percent is a postprandial blood sugar. And anytime your blood sugar level diabetic patient, try to keep around these values. Fasting around 110 milligram maximum and postprandial around 140. Okay, forget about this theoretical information. We have the patient, we will continue how doctor can think about it. For example, hypoglycemia can be understood. We have to ask the patient whether he has taken any insulin, whether he has, show me the tablets, show me the insulin. And then immediately you can find that there may be missed meals because of some other reason. The patient has not, because of the quarrel or disputes with the family members, he has not taken the food, he has not taken the meal, but he has taken the insulin. And also in the morning, he has went for the morning walk, long walk, to relieve the tension from the family members. So this is possible after coming home, not taking the yesterday's dinner, not taking any breakfast, but taking insulin, he can have the onset of hypoglycemia. Blood sugar level less than 60 milligram percent can cause danger. Less than 50, less than 40, oh my God, at any time the person can die. My dear friends, few seconds pauses I am taking and I am trying to explain you. In hypoglycemia and in hyperglycemia, hypo less, hyper more. Blood sugar less, blood sugar more. Which is more dangerous, doctor? This. Hypoglycemic coma can be fatal, fatal. The patient can die if hypoglycemic coma is not diagnosed, and if it is not treated very promptly, patient may die. But in hyperglycemic coma, there are chances that we can have the few hours, few days to treat the patient, and patient will not immediately die. But in hypoglycemic coma, patient can die within minutes. Okay? So diagnosis is more important. If hyperglycemia, how we can diagnose? That the patient is not taking the medicines regularly. Patient is not following the do's and don'ts. He regularly eats everything, sweets and all these things. He said, why I should worry? I will not bother about these regulations. And he is not following any do's and don'ts. At the same time, he may get the infection like upper respiratory tract infection, cough, cold, etc. And that's why this hyperglycemic condition always occur step by step, insidious. First he will feel weakness, then drowsiness, and then unconsciousness. But hypoglycemic can be drastic change. Patient was talking before and immediately he gets fainting attack and fall down. Okay. So all these things should be kept in mind. Now doctor will do the further clinical examination. He will check the pulse and also he will watch for the breathing style, breathing method. So first in the pulse, if there is a slow pulse, bounding pulse, good volume pulse with quiet breathing, this is indication of hypoglycemia. I repeat, in hypoglycemia, pulse will be slow, but bounding, good volume, and quiet breathing will be there. Breathing normal breathing. In hyperglycemia, when blood sugar is more, pulse will be not slow, pulse will be rapid and 3D. Rapid and 3D pulse, BP will be drop down, and tachypnea, fast respiration. Normal respiration 14 per minute, but and acidotic or sweet smell to the breath. Fruity, F-R-U-I-T-Y, fruity smell to the mouth in hyperglycemia. Okay. Now next difference. In hypoglycemia, the patient is overall looks healthy as if he is sleeping quietly, but that is dangerous. Not looking very any toxic and all this thing. He just quietly lie down, but he is unconscious. But in hyperglycemia, patient may look toxic, may look ill, and may have the fever, febrile. So these are the differences, hypoglycemia and hyperglycemia. Okay. Then doctor should check, is there any infection in the body? So he can auscultate the chest immediately for checking of the respiratory infection, RAS, bronchi, crepitations. For example, RAS, wet sound because of some fluid inside. Bronchi are the dry sounds because of the bronchospasm. Crepitations is a type of the RAS. Then doctor will also check the hands and the legs and the buttocks for any abscess, for any cellulitis type of the complaint. So in this way, doctor should try to immediately check whether the unconscious diabetic patient has the reason of hypoglycemia or the hyperglycemia. This is the main thing I wanted to stress in this video. Now, immediately doctor will check the blood sugar level. From the emergency bag, he has the glucometer, and then he can immediately diagnose whether it is a hyper or hypoglycemia. Now, if it is the blood sugar is less than 60, 101%, this is a hypoglycemia. Sometimes in the glucometer, after checking this blood sugar, their sign comes as a E. And many people think that E is like an error, my instrument is damaged. No, many times it is happen that glucometer has a capacity to record the blood sugar level. Some instruments, they cannot show the blood sugar if it is more than 500 milligram percent. It is too high for that instrument and it is showing excess or the E. So E sign indicates it may be the blood sugar more than 500 milligram percent. Okay. Now, there is another important trick, therapeutical test to diagnose hypo or hyper. I will tell you, very interesting. That means still you don't have the glucometer, patients, relatives and all these things. And the doctor is also forgot to bring that glucometer. Of course, it is not like that, but sometimes it happens. Then the simple test, doctor, if he is having the doubt about hypo or hyperglycemia, doctor can give bindhast, intravenous 25% glucose, 3 to 4 ampules. After giving intravenous glucose, if the patient wakes up, that is definitely hypoglycemia, and give more 25% glucose and continue with 10% dextrose drip at home or in the hospital. If by chance hyperglycemia is there, then doctor has another style of management, that is 2 to 3 normal saline fast one has to give. Then second IVs, when starting IV line, the doctor can or hospital can give the normal saline plus 20 units of plain insulin slowly. Also the doctor in hyper, I am talking now hyper, insulin has to be given. Then soda bicarb 100 ml slow IV, and higher antibiotics can be given, and patient has to be taken care in the hospital for few more days. So my dear friends, this is a short but interesting videos about hypo and hyperglycemia. If any doubts, you are requested to see this video again and again, and you will 100% clear the concept of hypo and hyperglycemia. So my dear friends, I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel, press the bell button icon to get the notification of such type of interesting videos. Now nearly 2 or 3 more interesting videos in this series, but you are requested to continuously follow all this serial of the problems in the general medical practice. Thank you very much. I wish all the best. Take care and see you soon. Thank you.